impact our mental health. But now some doctors are raising new concerns about people not getting help when they need it the most right now. Channel 3 Eyewitness News reporter Mike Savino is joining us right now with more on the long-term problems that this could cause. Very serious here.
Yes, absolutely, Mark. And even before the pandemic, researchers found that about half of all people who have a mental health issue weren't seeking help, as you mentioned, when they need it. So some doctors are saying that this is now continuing, and it's creating two pandemics, one of which could last long after the other.
At night, it would be one, then too many.
Gordon HILTZ always considered himself a social drinker, so he didn't think he had a problem when he began consuming more alcohol at the start of the COVID pandemic. But an intervention of family and friends helped him realize that he did have a problem.
It gets to the point where, I couldn't put my kid to bed. That's embarrassing. And it's sad.
Experts have been warning about the mental health impacts of the pandemic since it began.
We are not meant to be isolated. And it has caused numerous problems.
But now they're worried about another disturbing trend. People not getting the care that they need.
The data is really clear. For every 10 people who have a treatable behavioral health condition, less than 4 are receiving evidence-based care.
There are signs you can watch for to see if you have a substance abuse or a mental health problem. If you have changes in your sleep patterns or diet, see increased irritability, or if you find yourself suddenly avoiding contact with others, experts say that you should talk with a specialist. New technology makes that even easier.
Luckily, we live in an age where telehealth has helped. It's not the best, but it's better than nothing.
Even though many people don't seek help, treatment centers have seen an increase in demand. Even more therapists and counselors find themselves needing help.
Us as clinicians, we tend not to sleep as well. We'll spend extra long hours at work, which increases our burnout and provides compassion fatigue.
Now HILTZ is trying to help others. He suffered a relapse in the summer of 2020 after he lost his job, and now he works for Retreat Behavioral Help.
I tell everybody I deal with here, we're in this together.
Now, experts told me there are some things that you can do as a form of self-care, including having a regular sleep schedule, maintaining a healthy diet, and using technology to keep in touch with loved ones. But if you think that you or someone you know needs help, we have a list of places you can call on the Channel 3 app. Live from the newsroom, Mike Savino, Channel 3 Eyewitness News.
That's a good resource, Mike. Thank you.